and treat asylum seekers with dignity. With that, let me recognize Senator Hirono for her questions.
Thank you, Mr. Chairman. There was a time in 2013 when this committee spent around 2 weeks marking up a comprehensive immigration bill that addressed some critical needs in both the legal and illegal immigration situation, both of which systems are broken. I hope that at some point we can get back to that kind of a perspective, and clearly we have some bipartisan bills that will help. Sheriff Martinez, I hear your frustration. Clearly, we need to address the issues in the border that deals with another committee's jurisdiction. Also, but today I would like to focus on the dire need in our country for healthcare workers. If there's one thing that the pandemic showed was the importance of the essential workers, of whom many of them, of course, are doctors, our nurses, our healthcare workers, stretched thin to the brink of exhaustion during the 2 years of the pandemic and still not over. So in fact, just recently in Hawaii, our governor signed an emergency rule authorizing out-of-state nurses to temporarily practice in Hawaii without obtaining a license from the state. And we have a shortage of some 732 physicians. 732 physicians affecting our state pretty much right now. So yes, thank you, Ms. Peterson, for focusing us on the immediacy of the challenges. What kind of steps have medical facilities had to take because of the shortages in the healthcare workforce that you can share with us?
Thank you, Senator Hirono. The immigration process is complicated. It involves multiple different federal agencies, a lot of paper, a lot of time, and a lot of money. I have so many physician clients who have a job offer from a healthcare facility that wants to hire the physician, and they can't because we don't have enough numbers, it's not the right time. The list goes on. And so today, the Conrad reauthorization bill provides so many reliefs to our system for my clients, for doctors like Dr. Allure, to be able to recruit and retain physicians.
That is a bipartisan bill, right?
Absolutely bipartisan.
Does it lift the cap for the Conrad 30 program?
It does not. What it does is it looks at the states that use all of their 30 waiver numbers, and if they use them, then each year there's an add-on so that the states can really control and supply the J-1 waivers that they need for their application.
Would you support lifting the cap or increasing the cap substantially?
The demand is so great, and as I said, 2/3 of the states that the senators on this committee represent fill every year. Mm-hmm. And so I do think that the Conrad bill provides a smart solution to be able to give states back the power to get the numbers that they need.
Well, how much longer do you think, for both of you, can our healthcare system, and that includes the VA system, where there are major shortages, I know, of doctors and nurses. How long can these systems continue to use the kind of quick patches, such as a governor issuing an emergency order, for a problem that needs long-term investment and policy changes? Dr. Allure?
Senator Hirono, thank you for the question. It's a very important question. I don't speak for the VA, but this is my experience. The shortage is already an emergency. Mm-hmm. When we try to, from a rural area, when we try to get a veteran out to a hospital that can provide them services, often there are no beds because they're all working at reduced capacity because they don't have nurses. Often there are no doctors for 2 hours or so. Mm-hmm. So we are already in an emergency. I know the COVID pandemic has given a stress test of sorts to the healthcare system here, and we haven't recovered from that. Combined to that, the rural areas, which have more aging population and aging doctors, are projected to face even more shortage than the urban areas. And it has to be fixed now. There's really no time.
Ms. Peterson, the nurses in Minnesota have gone on strike because there aren't enough nurses to safely provide care for the patients. So are we going to see more of those kinds of actions by nurses and other healthcare providers who are just totally up to here with what is being asked of them.
I think we'll see that. I also think that the stress falls on patients. Just a week ago, I was told that one of my family members has to wait over 2 months to see a cardiologist, and I'm not alone. This experience was just backed up by a survey that looked at 15 major metropolitan communities, DC included, that says the average wait time for a physician is 30 days. And that depends on where you live and the specialty that you're seeking care from. So in addition to the stress on the doctors and nurses, it's impacting us, it's impacting my family, and it's impacting your families. It's urgent, and we need to address it through smart immigration reform.
Ms. Peterson, you mentioned your support for 2 bipartisan bills that we could push, and I would ask the chairman to and the ranking member to focus our minds on getting those bills, bipartisan bills, passed this session. Thank you.
Thank you, Senator Hirono. Senator Tillis.
Thank you, Mr. Chairman, for holding this hearing. I don't even know if I'll have time